Hello dear students, we present you a video today about work in the operating units. On the left we have the first room, which is called the sterilization room. As you can see on the left is a large autoclave. It's designed to sterilize large surgical instruments and materials. And on the table is a small autoclave designed to sterilize small instruments used every day. The second room is a dressing room. Here the surgeon changes his clothes. In the first closet, he puts his outer clothes, dirty clothes, and on the second closet, he has a clean uniform that he puts on. Then the surgeon goes into the next room, puts on a clean cap and shoe covers that he takes from the bix. Next step is hand washing. Touch sensors are installed above the sink, so when the surgeon brings his hands to the tap, the water starts to run automatically. First he wets his hands up to the elbow, then gets soap from the dispenser in the palm of his hands, begins to wash his hands up to the elbow. The soap is drawn from the dispenser using the elbow, in which case the surgeon should not touch the dispenser with his fingers or palm. He performs hand washing according to EN 1500 standards and repeats each movement 5 times. After the first stage of hand washing, he rinses his hands off with water to wash off all the soap. When rinsing, the elbow should be in the downward direction, so the water that flows down the palm should flow down towards the elbows. In the second stage, the surgeon washes his hands up to the middle to third of his forearm, then repeats the movements according to standards, and the elbow should always be directed downwards. At the third stage, he washes his hands up to his wrists, repeating each movement 5 times. After finishing his hand washing, he takes clean towels from the bix and dries his hands. The hand drying process begins with the palm then the outer side of the surface of the arm, and ends at the level of the wrist. Next, he goes to the sink again and uses antiseptic from the dispenser, applies to his hands, and he must follow the same rules. The first stage is up to his elbows. The second stage is up to the middle third of the forearm. And the third stage up to his wrists. During this technique, he repeats it until hands are completely dry. Next, he approaches the doors of the operating room, raising his hands to a sensor. Then the doors open automatically. When entering the room, the surgeon's arm should always be raised above the waist and should not come into contact with his surroundings. Now he's putting a gown. When putting a gown, he makes sure his hands do not go down his waist. Hands should always be located in the chest area. After putting a gown, the surgeon goes to the operating table. The nurse gives him the alcohol swab to clean his hands. Next, he puts the sterile gloves. He starts with the right hand. He fixes his gloves after putting both of them, just like in the video. Then the surgeon approaches the patient and prepares the surgical field. This is appendicectomy surgery. Nurse hands him over the povidone swab. Surgeon prepares the field from the middle to the periphery and repeats it 3 times. Now they will begin to cover the sterile field with the material, surgeon from one corner and the nurse from the other. Usually we use 2 layered covers. At the end, the operating field remains open and is secured with towel clamps. Here we have 4 towel clamps. Next, the nurse gives the surgeon the alcohol swab, which he uses to process the operating field one more time. Then he begins his incision. For the incision, the surgeon takes a scalpel and directs it to the incision site at the angle of 90 degrees, pressing the tip of the scalpel firmly against the skin. After making the incision, the surgeon directs the scalpel 45 degrees and finishes with 90 degrees. Operations finished, he takes off his gloves and leaves the operating room. When the door is open, it is advisable to press the sensor with your elbow. This concludes our video lecture. At the end of the lecture, if you have questions, you're always welcome to ask questions.